A ray of hope today from the drug giant Pfizer. They say their experimental vaccine is 90% effective. Good evening, I'm Mike Montecalvo.
And I'm Shannon Heggie. This means Pfizer's shot could get emergency use authorization from the FDA within the next few weeks once its vaccine trial is completed.
Now, the vaccine is administered in 2 doses. Experts say 50 million doses of Pfizer's vaccine could be made available by the end of this year.
12 News reporter Brandon Truitt is live at the Department of Health with the details on how this vaccine will be handled here in Rhode Island. Brandon?
Well, Mike and Shannon, the Department of Health says that they are ready to go once a vaccine's ready. They say they have the systems in place, but we're not there yet. There is some good news, though. One doctor today putting it this way: the light at the end of the tunnel is shining a little bit brighter today.
People should have confidence in the process.
A call for patience and trust from one of the nation's leading minds in this pandemic. Dr. Ashish Jha is the dean of Brown University's School of Public Health.
But the bottom line is this is really good news. A vaccine that might be 90 or 90+% effective. I think it certainly surpasses my expectations. I think it surpasses the expectations most of us had.
Pfizer announcing early results from its COVID-19 vaccine trials. Dr. Jha says he wants to see more data. Nonetheless, he admits it's a big step as attention starts to shift to how vaccines will be passed out when ready.
And there's been a lot of preparation.
Dr. James McDonald with the Department of Health says the state is ready, the system's already in place.
By the way, this is new, but it's not that new to the Department of Health. In other words, we know how to acquire a vaccine. We know how to deploy a vaccine.
Dr. Jha estimates if Pfizer keeps this pace, they could be approved to pass out vaccines by the end of the year. First responders and frontline workers would likely be first up, he says, followed by elderly people around March and the general public sometime in May.
My expectation is, and everything we've heard from the Biden team says that the distribution will be based not on who's well-connected or who's wealthier, but is really going to be based on need.
So it is still early in this. Pfizer is still trying to work out any potential side effects. I asked Dr. Jha about people who might be skeptical of taking this vaccine. He said he understood, but he's urging people to follow the science and trust the process. Live in Providence, Brandon Truitt, 12 News.
First at 6, local reaction to the possible breakthrough in the race for a COVID-19 vaccine. I'm Shannon Heggie.
I'm Mike Montecalvo. Pfizer's announcement this morning that its vaccine showed signs of being highly effective could be authorized for use in a matter of weeks offered the country and the world hope with cases surging again.
12 News reporter Brandon Truitt talked to local experts today about the news and the challenges still to come. Brandon?
Well, Mike and Shannon, we're here at the Department of Health because they are going to play a key role in distributing a vaccine when it's ready, but we are not there yet. I did speak to 2 doctors earlier today who tells me, as in regards to this update on a vaccine, they like what they're seeing.
The bottom line is this is really good news.
A positive outlook from a doctor known for telling it like it is. Dr. Ashish Jha is the dean of Brown University's School of Public Health.
A vaccine that might be 90 or 90+% effective. I think it certainly surpasses my expectations. I think it surpasses the expectations most of us had.
Dr. Jha says he expected a vaccine effectiveness rate around 60%, far lower than the 90% reported by Pfizer Monday. The study, sampling roughly 44,000 people from multiple countries, but these are early results.
We don't have that much data yet, but so far it doesn't look like there are any safety problems.
Dr. Karen Tashima agrees.
No, I think it's really impressive.
Dr. Tashima, with a career in the development and testing of vaccines, saying she likes what she's seeing from Pfizer, but wants to see more.
We're all looking for the data to be able to say with more confidence that this is something that we should all be receiving.
There are more hurdles to get through before these vaccines get from testing facilities to you. In the meantime, Dr. Jha saying we have work to do ourselves with what he calls a very tough couple of months ahead.
We're going to see large outbreaks, lots of infections, lots of deaths across the country. Unless we make some very substantial changes, I believe an additional 100,000 Americans are going to die between now and Inauguration Day.
So when it's approved, when it's ready, this Pfizer vaccine would require 2 doses, 2 different shots. Part of the responsibility of distributing that is going to fall under the president's Operation Warp Speed. It will quite literally be a military operation. Mike and Shannon.
Brandon, for people watching this story, they are probably wondering who's going to get the vaccine first.
Yeah, that's the big question. Dr. Jha telling me if everything stays on track as it is now, you could expect a first round of vaccines to be handed out to frontline workers and first responders by the end of the year. After that, elderly people, that population could get it by March, with the general public receiving it sometime in May. But guys, it's important to note all of that is depending on exactly how well this goes between now and then.
All right, Brandon, thanks so much.